Let's learn about lung volumes and capacities. The amount of air entering and exiting the lungs can be measured. Devices called spirometers can be used to measure lung volumes. If we were to graph the amount of air entering and exiting the lungs during resting breathing, it would look like this. The line goes up when the volume inside the lungs increases during inhalation, and it goes down when the volume decreases during exhalation. Each peak represents the volume of air that entered the lungs during inhalation. Likewise, each valley represents the volume of air that exited the lungs during exhalation. Tidal volume represents resting breathing. It is the volume of air entering or exiting the lungs during a resting inhalation or exhalation. If we told someone to breathe in normally, then breathe in as hard as they could and exhale normally, the graph would look like this. We could measure inspiratory reserve volume, which is the amount of air entering the lungs in addition to tidal volume during a maximal inhalation. We could measure inspiratory reserve volume from the peak of tidal volume to the peak of our maximal inhale. If we told our patient to breathe in normally and then exhale as hard as they could, the graph would look like this. Expiratory reserve volume is the amount of air leaving the lungs in addition to tidal volume during a maximal exhale. We could measure expiratory reserve volume from the valley of a tidal volume to the valley of our maximal exhale. No matter how hard we exhale, we cannot blow out all of the air in our lungs. The remaining air is called the residual volume. The residual volume is the amount of air remaining in the lungs after a maximal exhale. We would need to use other methods besides spirometry to measure residual volume. If we knew where this line was, we could measure residual volume from the valley of our maximal exhale to the zero line. Here are the normal volume values. Tidal volume is around 500 milliliters. Inspiratory reserve volume is about 3 liters in men and 1.9 liters in women. Expiratory reserve volume is about 1.1 liters in men and about 0.7 liters in women. Residual volume is about 1.2 liters in men and 1.1 liters in women. Lung volumes depend on the size of the thoracic cavity and lungs and can vary according to size. Lung volumes can be added together to determine lung capacities. Vital capacity is equal to the tidal volume plus inspiratory reserve volume plus expiratory reserve volume. If we were to measure vital capacity, we could take a measurement from the peak of our maximal inhale to the valley of our maximal exhale. Vital capacity is about 4.6 liters in males and 3.1 liters in females. Inspiratory capacity equals inspiratory reserve volume plus tidal volume. If we were to measure inspiratory capacity, we could take a measurement from the valley of our tidal volume to the peak of our maximal inhale. Inspiratory capacity is about 3.5 liters in men and 2.4 liters in women. Functional residual capacity is equal to the expiratory reserve volume plus tidal volume. To measure functional residual capacity, we could measure from the peak of our tidal volume to the valley of our expiratory reserve volume. Functional residual capacity is about 2.3 liters in men and 1.8 liters in women. Total lung capacity is equal to the inspiratory reserve volume plus the expiratory reserve volume plus tidal volume plus residual volume. Total lung capacity is about 5.8 liters in men and 4.2 liters in women. To measure total lung capacity, we would measure from the peak of our maximal inhale to the zero line. Lung volumes can be affected by obesity, altitude, pulmonary fibrosis, pneumothorax, and pregnancy. We hope you have learned something about lung volumes and capacities, and see you next time.